I rarely say Kegel. It makes me cringe because it doesn't tell me anything. In fact, it makes people engage their pelvic floor muscles even more wrong than they were. I give people cues that are going to optimize the pressures inside their body so much more than when they go see a gynecologist. But they're not going to tell you, hey, your pelvic floor is tight and that's contributing to why you're having pain with sex. It's hard to tell when you're strong on the outside. As a result of 23 years of trying to have this shredded six-pack, I have a grade 2 prolapse. Never had kids.
Welcome to the Vitalist podcast, where healing meets wonder. This is your space to gain transformative knowledge, deepen your mind-body connection, and awaken your human spirit. If you're ready to connect with your innate potential, embrace life's challenges, and expand what you believe is possible, this is the place. Get ready to slow down, be moved, and live like a true vitalist. Welcome to the Vitalist podcast. I'm Dr. Keiko, and I'm here with Dr. Jocelyn, part of Vagina Docs, and we're here to talk and unpack everything about the pelvic floor. You are an expert in this area, and I have to start. How did you get into the pelvic floor? You're a trained PT. What made you get into pelvic floor?
I would say it started off with, unintentionally, my own issues. So if we rewind to 2009, I had a non-contact ACL tear. And after that, things just started to happen physically that were connected to things that I had experienced as an athlete, but I hadn't put the pieces together until things start to get worse. So at that point, I let go of soccer and basketball and I started running. And I started to pee my pants. First and only marathon. I had just peed the entire second half. And through the training, I would pee and I'd go to my doctor and she'd say, "You must be weak. You got to do Kegels." After that, things started to really go downhill. So at that point, sex started to become painful. At the time, I feel like I was in such a wounded period of my life. Like I didn't have that self-love that I have since developed. And so at that point, I go back to the doctor. The doctor said, "You just need to be in love." And so one thing led to the next. I was at the time an engineering major and I was reaching a point in my life where I'm like, I hate this. I need to do something that I love. So being that I had been in physical therapy for such a long period of time, there was a pelvic floor physical therapist there. And I was intrigued. And then I was taking women's physiology classes, learning about like missing periods wasn't normal. I had experienced a lot of dysfunction around my period growing up, a lot of pain, a lot of irregularity. And the things that I was learning in school, like doctors aren't trained and they're just giving these girls birth control. That was my reality. And so I just felt this fire light up, but I didn't know where to start. Like, what do I do about my situation? I'm peeing my pants. That doesn't seem right. Like, whatever this doctor's telling me, it doesn't feel right. And then what's the deal with this pain with sex? I didn't have this before. Now I can't even use a tampon. So then fast forward, I get into the top 2 schools that I had wanted to go to, which was Pitt and WashU. At that point, I went to Washington University in St. Louis, and it just so happened to be one of the best programs for pelvic floor physical therapy, like people interested in that. And I remember sitting in class, and the teacher was saying, if you experience X, Y, Z, leakage, pain with sex, if you've had different injuries, it might be related to your pelvic floor, and everything checked the box. And I felt so seen and so heard. I'm like, this is it. This is everything. This is like probably explains a lot of the issues I experienced as an athlete. And it's the secret to unlocking athletic performance. And opening the doors to just a more freer life living in my body. But at the time, I'm like, no one is going down there. Too many people have dismissed my experience. And so I'm like, I put it on the back burner, but the universe definitely had different plans for me. So it just so happened that it was a lottery system in PT school. So I ended up in Ames, Iowa. That rotation just so happens to be a rotation that had a pelvic floor physical therapist. And I was like, hey, Katie, here's my situation. And so Katie has this energy about her. She's just secure. She holds space for such like intimate information that people are bringing to her. I just felt safe to tell her. And she does the exam and I'm like, before the exam, I'm telling her, hey, I'm so sorry you have to do this. I'm such a hot mess. She said to me, you have to promise me that I always get emotional telling this story. She said to me, she's like, promise me that you'll never call yourself a hot mess again. And that day changed my life. And so I remember she had showed me a picture. Not a picture. She was like, are you okay if I give you a mirror to look to see like you're perfect? That this was the first time that I had ever even looked. And I was like, wow, I created these stories about myself that just aren't true. And so that day has since transformed my life so incredibly that I wish to give that transformation to other people.
It's an important story because it's not just about the function of the pelvic floor, right? It's not just about, making sure things are symmetrical, make sure you're breathing right, make sure you're moving right, but it's an emotional story because it's an emotional area of the body. And I think a lot of women have silenced that part of their body. They've never even looked at it or seen it. And so if you have pain or discomfort in that area, you almost want to disconnect from it. And you don't listen. You don't want to listen to it. And then you lost trust in your body because of it. So you went into like a shutdown. So I don't think you're alone in that. And I think that's why you can help so many people with the work that you do. But I think let's start with the basics first. What is the pelvic floor? Like, how do you explain it in the simplest terms?
So the pelvic floor, like any muscles in the body, are just muscles that provide support to the body, specifically to the pelvic organs. So our intestines, the uterus, and all the other gynecological organs in the bladder. Stability of the hips, stability of the spine. The pelvic floor plays a pivotal role for our sexual function. We have specific muscles that help anchor our key pleasure organs, as well as the pelvic floor musculature as a whole that are involved in the experience of sensation during intimate moments. So I said stability, support, sexual functions. The fourth function is sphincteric. So we have two sphincter muscles, which are circular muscles, one around the urethra. Well, there's three tiny ones around the urethra, one of which is the sphincter. And then the anal sphincter. Both allow urine and feces to pass through at appropriate times and then keep it in at appropriate times. And then the pelvic floor assists with bringing blood flow and lymph flow back to the heart and back to the upper parts of the body.
And how is the pelvic floor connected to our core and our breath? Like most people know it's connected to the diaphragm, but how do you explain that?
The way that I try to keep it simple is I talk about the pelvic floor as part of the deep core system. So we have this deep core system, which I believe is the most important muscular system of our body because it really helps other systems in our body, such as our vascular system, our respiratory system. The other day I was reviewing stuff with the brain and, you know, how we have the pressure system in the brain, it assists with that. It assists with digestion. And when it is dysfunctional, other systems have to compensate, specifically like our outer core system. So what's the difference between the deep core and the outer core? The deep core is consisted of the diaphragm, which sits underneath our rib cage. I like to call it like the roof of our house. Then the pelvic floor serves as the foundation. Then we have walls of our house, the foundational walls. We have the transversus abdominis, which is a muscle that goes around like this, attaches at the spine, and then comes in and attaches to connective tissue in the front. And then we have deep back muscles. So how breath is so connected to our pelvic floor is when we breathe with our diaphragm, the diaphragm, which is shaped like this at rest, flattens and it pushes our organs down and out. And our pelvic floor elongates, as well as the other parts of the deep core, to accommodate the movement of our guts and our pelvic organs. And so when one of those deep core members are not doing their job or they're too tight, then other parts have to compensate, become overactive, or our outer core musculature has to compensate, and then the whole system is impacted.
Wow, pretty connected.
Yes.
So, I mean, this is a very intelligent, synchronistic system. I mean, breathing, you shouldn't have to think about breathing. So what is causing the tension? What is impacting our inability to just breathe what's so natural?
I think it comes down to the state of our nervous system.
So stress, how we regulate.
When we're stressed, we tend to breathe up around our neck. We use our accessory muscles, our accessory breathing muscles, to help pull in air. And then I also think lack of movement. We're not challenging our body, so our body's always going to take the path of least resistance. Just like any muscle, the diaphragm needs trained.
Yeah, where do you think people live if they're not connected to their core? Like they just live in a disconnected state, right? So they're moving without that embodiment. And so no wonder their posture fails, or no wonder they're compensating with different muscles.
We live on our phones. We live...
Well, maybe that's where the attention is. It's outside of us.
It's outside
of us.
Not
inside.
Correct. I had learned something about, I can't remember, she's a neuroscientist, and she says that we have way more than just our main senses. And I remember having this argument with one of my mentors because I had tutored for her. She was just a very feared neuroscience professor at Penn State. And I said, what about more intention behind our movement? And she just squashed that. But that's the essence of everything that we're trying to achieve now with this presence and being in the moment.
Yeah. And this is huge right now. Interoception is like the big word that everyone's using. And it's the master sense. You know, the five senses kind of come from our ability to receive the information of the body, whether it's hunger cues, whether it's our heart rate, the deep connection to our deep core even. That's a huge interoceptive ability. So, okay, let's unpack, why would people come see you? Because I didn't know to come see you because I don't have leakage. I don't have pain with sex. I don't have any of the other main flags that would make someone seek you out. What are the sneaky things that are kind of weaving in that people don't know to come see you for?
Well, the obvious ones you kind of mentioned: bladder leakage, constipation, painful bowel movements, post-birth care. Say they tore or they had a long labor and they're struggling to just live in their body. Sexual dysfunction, although I think I'd like to see more people with sexual dysfunction, but I think, like myself, it takes people a long time to trust healthcare providers again. You go to the gynecologist and they're like, check, you don't have an STD, check, you don't have abnormal cells. Do you want birth control? Here's your prescription. You sure you don't want an IUD?
Right. It's very medicalized, very treatment-based.
And then see ya for your next PAP in like 3 years now, or 1 year for some, 6 months for some.
Are they even trained to like feel the pelvic floor?
Not everyone. It's the newer, hungrier providers, I think, that do a really good job. It's getting better, but we actually are some of the greatest people to do that well women exam, minus the pap smear, because we can sense chronic things that are not an acute infection, but chronic, say, low-grade yeast overgrowth that's pouring over from the gut.
Right. How do you sense that?
It's a visual. You have a light white hue of the tissues. There sometimes can be an odor to it, but not always. And then there's odors that tell me whether or not someone's drainage systems are doing well, or their gut, how the state of their gut is. And so when people come in, we give them so much more than when they go see a gynecologist. Not that I'm saying that they don't go see your gynecologist. You need that. But they're not going to tell you, hey, your pelvic floor is tight and that's contributing to why you're having pain with sex, or your constipation might be related to your rectal reflexes due to your tight pelvic floor and the fact that your pelvic floor is tightening when it's supposed to be relaxing.
Okay, what are the myths that really tick you off about the pelvic floor?
Gosh, the top one is, the top two equal would be, the only thing that I do is teach people Kegels. It is the most offensive thing. I rarely say Kegel. It makes me cringe because it doesn't tell me anything. In fact, it makes people engage their pelvic floor muscles even more wrong than they were. And then I want a tight pelvic floor. That is an archaic myth that women should have a tight pelvic floor. In fact, I've seen way too many people who have had too many stitches, like the husband stitch is what they call it.
What's that?
It's definitely more old school OBs would do an extra stitch.
Oh, to tighten the pelvic floor.
To tighten the vagina.
Oh,
and as a result, the outer layers of the pelvic floor are impacted.
How do they get impacted? They just become tighter because the fascias.
Think of that stitch as like a snag. So our body, even though that we might have tightness in one area, we have to find the snags. Where is this tightness coming from? And so with my expertise in pelvic floor health, but then my ortho background, my sports medicine background, I have just a much more trained eye to say, yeah, you're peeing your pants, but you're peeing your pants because your neck is in a certain position or your foot is doing this.
Yeah. How do you get people to see that connection? How does my bladder have anything to do with my neck tension or my foot tension?
Getting people to feel it and experience it and trust that they can do whatever movement that they are typically or traditionally leaking so they avoid it. Having them lean into it and teaching them new ways to approach that movement so that they don't leak.
You did this to me in our first session. You asked me just to pick something off the floor. And so I just picked it off, not paying attention at all to how I was picking it up, my breath, my posture, anything. And then you were like, what's your strategy? And I was like, to pick up the pen. And you're like, with your body. And so you taught me inhale on the way down, exhale on the way up. And it was just this subtle cue that it changed how I just move in general, how I pick up anything. So what are some other subtle cues that you really these are your gold standards for helping people connect more to their body with movement?
So once I teach people how to connect, then I'll say things like, take up the slack versus brace. Teaching people how to vary or modulate their intensity with their core connection. And when I say core connection, I'm talking about light pelvic floor connection, light abdominal connection, making sure the ribs are connected to the pelvis, approaching a movement in a way that is most optimal for that movement and for the pelvic floor. So what that means is I give people cues that are going to optimize the pressures inside their body. So when the pressure inside the bladder is higher than pressure at the bladder neck where urine comes out, there's a leak.
So how do you control the pressure? I mean, when you taught me this, it was more subtle. It was more, I was over creating tension to try to brace my core or whatever, to tighten it. And you were like, no, it's like a soft whisper of like a.
The first thing I have to do is get people to come into their body, gain an awareness myself of like, what is it that you're doing? And so remember, you had to like reverse engineer. Okay, what did I do?
Yeah, exactly.
Like when I'm assessing you, say with breathing, I'll pay attention, like, are all the spots, are your ribs opening? Is your belly expanding? And then I use all that information to guide how I cue you. So maybe we adjust how you breathe a little bit. Maybe we, for you, back off on any core engagement, but we initiate movement with the glutes. So we're redistributing pressure. We're changing forces through the tailbone, which interact with the pelvic floor and therefore the bladder.
You said this to me in my session. You're like, you're strong on the outside, but weak on the inside. Like just being able to do a sit-up with the right internal connection. So can you expand upon that? Because I think a lot of women, they look like they have a good core, but the deep core is so weak. So how do women know, like, oh, how do I know if my deep core is weak?
I would say to know if your deep core is weak, think about patterns and habits. Like, do you ever leak with laughing, coughing, sneezing, jumping? Because if so, that is a indicator. It's hard to tell when you're strong on the outside.
Yeah, because you can compensate.
Yeah, because you can compensate. So what people do, and maybe this will help more. You know how when I tested you, I had you use your hands a lot to feedback, like
to feel it.
Yeah.
Yes.
So for instance, lay on your back. Like if you're listening to this podcast, lay on your back and put your fingers below your belly button. Really dig them in. And I want you to engage your core the way that you know how to engage it. And then pay attention. Do your fingers go up or do your fingers go down? If they go up, it's usually an indication that you're either overdoing it. And so your outer, like the obliques are kicking in, the rectus abdominis, the six-pack muscles, they're kicking in. And so the pressure's raising. And so you're being pushed out. Another one I like to tell people to do or have people do and feel is lay on your side, do the same thing, put your hands on the side here, engage, and feel what happens underneath your fingers.
So you're right above the hips, in between the rib cage and the hips,
yes.
Right? Okay.
It should say soft in there. If it gets hard, it's usually the obliques kicking in. That doesn't necessarily mean your deep system is weak. It just might mean you have not accessed it. You've just bullied it with the outer system. And the last one I really love to do, same thing on your back. I typically will guide people to flatten their lower back into the table. And I have their fingers also still
below
on
the
there.
button.
Yep.
Okay.
And then I'm assessing, like, do you engage your glutes to get you there?
Oh, I remember you did this with me. That's right.
That, if you want to see me get real passionate, that'll get me there. That is an indicator that there's dysfunction in the coordination between the deep and the outer core system, and the glutes, possible underlying weakness of the deep core. You just never give that deep core room to shine because we're trying to like put this image out that we have a flat stomach or that we have abs. I'm guilty. And as a result of 23 years of trying to have this shredded six-pack, I have a grade 2 prolapse. I've never had kids.
Okay, this is interesting because a lot of women that have pelvic floor issues, it's typically women that have kids. It's not people that haven't been through a childbirth. But I'm curious, how does the pelvic floor change with different kinds of birth? Like, what do you see with C-sections versus vaginal births?
I want to preface my answer first by saying I think the people that have issues with their pelvic floor after are most common the women that have issues beforehand that never got identified. Because I have seen so many women that I wouldn't even know they had a baby.
And what does it feel like? What does it look like?
In those cases, the pelvic floor feels like it should. Like when I do my exam, the inside of the vagina feels like the inside of their cheek, like my cheek. Pops out whenever I put my finger into the tissue, pops right back in, versus an unhealthy like Tempur-Pedic mattress or Have you ever felt like chewed meat?
Yeah.
Like that sometimes is the quality, the tissue quality that I feel.
Right.
Now to the question of how do different types of births present? Well, I would choose vaginal birth. I would never choose a C-section if I could over a vaginal birth, just because it's much harder on our pressure system. And remember that deep core is the queen of the pressure system. And so when we're cut into our pressure system's cut, seems like, or it is not uncommon for the pelvic floor to get pulled into that scarring of the C-section. Now, that's not always the case. I'll have patients that had C-sections that their pelvic floor is perfect. And then the vaginal bursts, when we're talking a slow, steady vaginal birth where baby's descending at a controlled rate, and there might be minimal tearing, grade 1 tear, maybe minor grade 2.
Right. Okay. So is there a positional thing with this too? Like with women are in back labor laying on their backs, does that change how they engage the pelvic floor with labor and delivery versus on like all fours?
So the downside of giving birth on your back is that the sacrum and the tailbone don't have the freedom to move as it would in a different position, like say a supported deep squat, supported hands and knees, side lying.
Okay.
So yeah.
Different positions.
Positions. And then movement during labor is really important. And so if say someone, not that I'm personally would probably get an epidural. I know my pain tolerance. Would I try? Maybe. But I think I know enough. I tell my patients, I don't care if you get an epidural or not. We still have to build this awareness.
True.
You can't skip out on that.
Right.
The downside of, say, an epidural is if you get the type that addresses both sensory and motor function, you can't move. And so that can impact.
And then you can't feel anything, really.
And you can't feel anything. So we have to make sure that's trained beforehand.
Okay.
So that no matter what happens, you're prepared.
Okay, let's talk a little bit about, because we don't want this just to be for women, but men, you see men with pelvic floor issues. So how does a man's pelvic floor differ than a woman's?
The biggest difference, I think, to the male pelvic floor relative to the female is based off of their pelvis shape. So with the pelvis shape in men, they have a less wide pelvis, more narrow. And so the depth is a little bit different. I would say access to their external anatomy is different than women. So for instance, we have 3 layers of the pelvic floor, and these different layers serve different roles. Layer 1, key functions for both men and women are sexual functions and structure and stability. So for instance, our layer 1 muscles and layer 2 support system help give shape to the vaginal canal, similar to an erect penis or just a flaccid penis as well. And so I can access those outer layers really easily in men. I can access those on women, but I just feel like I get much more, like someone that is complaining of insertional pain with penetration, I get most bang for my buck if I'm stretching just inside the vaginal canal, or if it's more of a posterior or back side of the pelvic floor, we're talking rectal in through the anus.
Okay.
Wow, that sounds weird.
I know. You have vagina, anus. I mean, these words, people don't like using these words.
No.
They're very taboo.
Whole
and I mean,
yeah.
You even named yourself the Vagina Docs. Like, you wanted to be provocative. You wanted just to name it, say it out loud. You know, the vision you see for how women are talking about their bodies, because there's so much shame and embarrassment. And I would argue I send a lot of women to you and they're not ready.
No.
They're not ready to be seen down there. They're not ready to have that. And, you know, maybe we can segue into this, but how do you help women and men get more comfortable with showing up and being seen that way and feeling that connection to their part of the body?
My goal is to build trust like instantly. And instead of me telling them what they need to do, I just guide them into their own awareness. And then I asked them, what do you think we need to do here? If X, Y, and Z is what we're finding, and X, Y, and Z is the solution for X, and that how do we proceed from here? And I think that approach has built, like, teaching people how to engage or connect with their body in ways they have never been taught, and giving them information that they've never known before. And they've been going to gynecologists, they've been going to see trainers, they have been working out with this sort of way all their life, to give them something that is so impactful immediately that on day one, I think that's how it's done, or that's what's worked for me. And people that are literally terrified, the moment they come in, I can just see they soften as they come in. Healing this area of my body has been the vehicle for growth that I didn't know was possible. I keep coming to back to my why of like I have very purposeful work.
Yeah. Okay, let's talk about stages. I mean, we go through milestones. We go through puberty. We go through maybe having a baby, being pregnant. We go through perimenopause and menopause. Is there anything like, this sounds, I don't want it to sound like this, but does like the pelvic floor age with these milestones, or is this like a natural thing that happens?
I would say yes, because the pelvic floor is so heavily influenced with our hormonal cycles. When we are in menopause, our estrogen levels are at a significant decline. And as a result, we experience dryness due to less blood flow due to the estrogen's role on our vascular system. And we lose fat, adipose tissue in our pelvis. And so the tissues, the pelvic floor themselves, can get thin and more frail. So if you wait to address this area in menopause, it gets a lot harder than if we start now. I try to encourage women in every stage of life is we have to jump. We have to put forces through our pelvic floor that is going to teach the pelvic floor to respond quickly. Sneezing, coughing, yelling, vomiting. We can't really get those forces unless we train those forces. Not through Kegels, but through specific types of training. What I love about the pelvic floor is it really is a compass to guide us whether we're off in these different life transitions. Say sex isn't comfortable. Say our bladder, like we're not able to empty our bladder. Say our bowel movements get hard, like it's harder to have a bowel movement. Libido is more on the hormonal side, which will affect the pelvic floor, but I think staying on top of this area through every transition mitigates the long-term effects that happen in menopause, which lead to bigger issues. So let's say women are leaking, so they stop working out. So now their bones are starting to rapidly decline. Then they step off of a curve, fracture their hip. Now they're even more incontinent. Now they're getting a bladder infection and their brain is going. It just starts to become a snowball, and it all may have started with a leaky bladder.
Right. Take me back to, like, if I'm going to sneeze or cough, how should I prime my body to feel my sneeze from like this inward sensation?
So I love this one. 2 components of this. Now, it doesn't always work if we get a sneak attack, right? But the first is the loading phase.
Okay.
When we breathe in, because we're going to cough, we want to keep it low. So ribs open like this, belly opens like this, and then we do our cough. Now, after we take our breath in, we're going to engage the pelvic floor to provide bottom support.
Yeah, I feel that.
As we cough or sneeze. That's called the knack.
Okay, you have to elaborate on engaging this.
Okay.
And you told me the bean thing.
Yes.
So I'm going to let you say it.
I love the bean. There's a lot of different cues out there. So many ways to train the pelvic floor because there's different fibers. But the cue with the beans, I found, is the best at recruiting all the pelvic floor musculature. So you're going to imagine you have 2 beans. One bean sitting at the vaginal opening, the other bean sitting at the opening of the anus. And these are vagina owners because male cues are a little different. You're going to squeeze both beans and lift them into the canals without squeezing your butt cheeks, keep it generally you want to keep your belly somewhat relaxed. There is synergy or coordination with some of the abdominals, but you don't want it like really hard. And you should feel a sensation like between your sit bones. If it's in your abdomen, you're probably overusing your abdominals. A little bit is okay, but if that's where you're feeling it the most, that's a sign. For men, I would say there's different cues, but I like two the best. Okay, imagine the shaft of your penis was a turtle head and you were pulling the turtle head into the shell. I also like lifting the scrotum, and I'll have them look in the mirror and see what happens with the cue. And again, no squeezing your butt cheeks. Guys are really, really, women win on who's better at coordinating. Men just like squeeze way too hard typically.
Yes, they use the other muscles.
And they squeeze their butt cheeks or their glutes. Well, so do women, but guys are much. You tell them to do 5 Kegels and they do 50.
Okay, let's talk about orgasm. There were a couple questions that our audience did ask. How does connecting with your pelvic floor change your ability to orgasm or enhance it or to feel it more? I mean, give me everything you know about pelvic floor and orgasm.
Man, so let's start with just gaining an awareness and how I approach people in sex rehab. Very different than, say, bladder rehab. And I'll teach people the 4+ ways how to engage their pelvic floor. And just by that, they have more sensation. So orgasm, they'll see shifts in orgasm just by having more sensation and more connection and more brain mapping. Now, I talk about orgasms like I talk about fitness movements. I can't, just because I can do a push-up does not mean I can do like a barbell snatch. Essentially, like if you're just used to orgasming on your back and you want to have an orgasm in hands and knees, you have to train it. So let's say, for instance, you struggle having an orgasm with a partner. Well, maybe you need to spend some time like being one with your vagina and your vulva in the positions you want to orgasm in. And you need to play around with like the interaction of your pelvic floor. Maybe you need to engage this part. Maybe you need to engage that part. Maybe you need to lengthen. Maybe you need some abdominals. I don't know if anyone is listening has ever had a coregasm where you're doing a core exercise and suddenly you're like, oh shit.
Yeah, why does that happen?
I wish I had a definitive answer. I think it's because of the synergy between some of the abdominal musculature and the pelvic floor. And when we're doing certain movements, it's just like a lot of muscle metabolism is just happening in that area, and you just hit that threshold for a tonic contraction.
So is it maladaptive, or is it something like, oh, if you have that, that's a lucky thing to have?
It's only maladaptive if it inhibits your life in a certain way. If it's happening every once in a while, it might indicate you may have a little bit of tightness. I would say that was the case for me. Was super tight around my clitoris. Yeah, so it's a super fun journey, but you have to take it, and you can explore with different tools out there to help experience different sensations. But there's not just one orgasm you can have. You can have all different types. You just have to train and spend the time developing it.
Okay, I love it. You do have a pelvic floor DIY exam. Is that on your website or?
It is.
Okay, so people can start there if they feel a little apprehensive about getting their pelvic floor checked.
It's tough because it took me like 4 years after this story with like Katie. I treated myself for a long time, and then I saw a pelvic floor physical therapist 4 years later because I knew once I opened that door, there was no turning back. It questioned my relationships. It questioned everything. It opened a door to me that made me realize that I wasn't choosing me ever. I say I'm here when you are ready. You just got to be ready and know that like who you work with makes a difference. Those people that hold space for you, much different. Like not every provider, like in any other industry, is created equal. So do make sure you feel safe, you feel held energetically.
If you could say one thing to any woman, what would it be about the pelvic floor?
Hold your power. Own it.
So what do you mean by own it? Because this is a big cultural thing that you're trying to steer.
There is no shame in nurturing this area of our body, from talking about it, from thinking about it, and from prioritizing it as a key area of our life, because owning this area might be what keeps you out of the nursing home. It might give you 20 extra years of life where you are moving freely in your body. If I could talk to that, gosh, I didn't say the word vagina until I was 18 years old. I would spell it. If I could incite any sort of wisdom, it's like when we open this area up, we develop a confidence that is not there when we feel mastery of our shoulder. And when we own this area of our body, we can speak up for what we want. Like, say, in relationships. If we don't know what's going on down here, how the hell is your partner going to?
Very true.
If we don't know about this area of our body, how do we know whether it's right or wrong if someone touches us a certain way? So owning it means like not feeling shame, or it means like stepping out into this world with a confidence that you're a vagina owner. Or, I mean, for men, a penis owner.
If people could practice one body cue daily, what would the body cue be?
I think it depends on the person, where they are, where their nervous system is. Say for the people that are high achievers, more in the fight or flight of state of their nervous system, I'd say breathe into your vagina. For those that are more like chill type B, I would cue them to connect to those beans.
Okay, the beans.
I feel like the most important thing for the pelvic floor is what we put into our bodies, like the food that we eat, how we talk to ourselves. So if you're constantly beating yourself down, your pelvic floor feels it. And then moving, training.
Yeah. I like that. How you talk to yourself is a really good indication into how you're connected to your pelvic floor. And she hears everything. Like the body listens to everything.
Everything. The version of me that called myself a hot mess, very different than now. And it's really amazing now that I've been in my career for a while now, seeing people that I saw like, say, 5 years ago, they come in with a completely different vagina.
And probably persona.
Oh, yeah.
Like the way they show up is very different in the world.
Yeah. Change your pelvic health, change your life.
Okay.
Own your pelvic health. Own your life.
All right. Here's to owning it. Where can people find you if they want to connect with you, if they want to learn more, if they want to come see you?
The best place to find the Vagina Docs would be either on social media. We're more active on Instagram and YouTube at Vagina Docs, or our website. You can find everything, vaginadocs.com. And then if you want to come in, we are located in North Central Phoenix off the 51 and 32nd Street.
All right. Here's to owning it.
Here's to owning it.
Dr. J, thank you so much.
Thank you so much for having me.
If you like this episode, share it with a friend. For more conversations filled with awe and wonder, be sure to subscribe to the Vitalist podcasts. Till next time.